Hi, I'm Nicole Birch, a genetic counselor at the Community Health Clinic. Today we're going to discuss carrier screening. Carrier screening is a type of genetic test that tells a person for which recessive genetic conditions he or she might be a carrier. A carrier is a term we use a lot when we talk about recessive genetic conditions. I've covered recessive inheritance in detail in another video, so I won't go into it here. In summary, a carrier is a person who is not affected with a recessive genetic condition, but carries along a variation in one copy of a gene that is associated with a recessive condition. Then that carrier could potentially pass on that variation. And if the other parent could too, if the other parent is also a carrier, then that child could inherit two variations total, one in each copy of a gene, and be affected with that recessive condition. Carrier screening, then, can help a person know for which recessive genetic conditions his or her children might be at risk. Carrier screening is performed for adults and is generally not used to tell us about anything going on health-wise for that individual person. It's more so used as a proactive test to give us more information as an individual or husband and wife prepare to have children of their own. One advantage of knowing carrier status for a couple ahead of time or before they have children is that there are many recessive conditions that have treatment available, but often that treatment needs to start as soon as possible within days after birth. So if a baby is born and we suspect a genetic condition, but we don't know already that the parents are carriers, we can't start appropriate treatment until we have an answer, which can take a while, and sometimes every moment is precious in terms of initiating proper treatment. However, if we know ahead of time that parents are both carriers for the same condition, we can perform genetic testing on the baby right at birth and get results really quickly, and then be able to start any treatment or proper medical care right away and to really help guarantee the best health outcomes for that baby. Carrier screening can sometimes be used in a diagnostic setting or when we're trying to find an answer for a family member's health problems. One example is if we see a child at the community health clinic and we suspect that the child has a genetic condition, we might perform carrier screening on the parents to help narrow down the possible conditions for which the child is at risk or the list of conditions that might match the child's symptoms. We might also perform carrier screening if we see a couple who had a child pass away of a suspected genetic condition. Since the child isn't living, we can't do genetic testing on the child. But if we perform carrier screening on the parents, it can give us a lot of information as to which condition the child may have had. That then, as you can probably imagine, would give the parents a lot of closure and also provide information for their other children and even grandchildren. Since being a carrier for a genetic condition usually doesn't cause any health problems in the carrier, it's really hard to know whether someone's a carrier for a condition unless we do carrier screening at some point. Usually being a carrier is a hidden phenomenon, but it has taken place for many generations in a family. Without carrier screening, we only know about carrier status until or unless a child is born with a recessive genetic condition. And then we can work backwards and say that the parents are carriers and then test some of the parents' siblings and maybe some of them are carriers too, and so on and so forth. But carrier screening is the best tool for being as proactive as possible, for getting information ahead of time, and then we're here as your team to help you figure out what it means, to help you plan for the birth of your children, to give them the best health outcomes possible. Overall, carrier screening is a very important tool for the health and care of our patients at the Community Health Clinic, and hopefully this video helps you see why that is.